Passed, all right. Well, it's 1:31 on February 22nd. We'll call the Health and Human Services Board to order. We will begin with the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Sarah, do you want to, if I move way over, you could probably join us.
Good afternoon, everyone.
I'd be happy to do that.
Staff to get situated.
It's way better than standing up
We
there.
thought we would let Sarah join us.
Well, I guess we'll begin with dispensing from the February 8th Health and Human Services Board minutes. If there's no correction, I'll entertain a motion.
I'll second, I'll make a motion to approve. I'll second.
We have a motion by Commissioner Hewson, second by Commissioner Weather. Is there any further discussion on the minutes?
Thank you.
No, I just want to know where her mind is.
Obviously not here.
All right. No other discussion. All in favor, say aye.
Aye.
Opposed, same sign. Minutes are approved. Next item on the agenda is the approval of today's agenda. Is there any corrections, additions, or modifications to today's agenda? If not, I'll entertain a motion.
So moved.
Second.
All right, motion by Commissioner Dolan, second by Commissioner Hewson. Any further?
No.
Or sorry, Commissioner Wetter, I'm sorry. Second by Commissioner Wetter. Any further discussion?
One of us.
No discussion. All in favor, say aye.
Aye.
Opposed, same sign. All right, there is no consent agenda today, so we'll be moving on to the regular agenda item. The discussion of the 5-year WIC contract, which would be ending this year, and we'd be looking at a discussion to take it, if it would be something we would want to entertain, taking over as a county starting in the fiscal year of 2021, correct?
2022.
Or 22, I'm sorry. We're in 2021.
However, at the bottom of your sheet, if you printed it out, you'll see the key dates, and that's kind of what's driving this meeting, is that just like last year, we're kind of running up against some time frame hurdles. So we anticipate that MDH will be releasing the RFP on March 1st. The letter of intent is due to them on March 16th, and the grant application is then due on April 2nd to be considered. So, but the whole thing doesn't start until next year.
The whole thing was?
But the grant would actually start next year, and the 5-year period starts next year, but we need to, if we were to act on it, we would need to be doing it by the early part of April, at the latest.
The Wright County Community Action has to do it them. They fill out the form themselves, but then they get a waiver from us saying that they can do it.
Right, so Sarah can explain, it's a right of first refusal. We're, again, in the summary, we're one of the few counties that haven't taken advantage of having the program in the county. So yes, they would, for them to RFP, we would have to provide them with a refusal of our doing so. So we're here to kind of see what the board's thoughts are on this.
Right, so that's exactly right, what Jamie described. So the process is every 5 years they renew the grant. We basically have to say no thank you for it to move to the next entity. Obviously, it's a large sum of money, as well as a program that's utilized by other counties in-house. So I firmly believe this would be a board's, looking for board direction on what you'd like us to do with that. There certainly are some opportunities. That's why other counties have taken that program in-house. We've sort of aligned some of those for you on this analysis. There's also some risks, particularly to community action. I don't think that's something that should be glossed over. I can go through each of these bullet points if you'd like. Is that helpful?
Mm-hmm.
Yeah.
Okay. So I'll start with WIC is a nutrition education program. It also has it's income eligibility that drives it, but it also has some income benefit. It's a food benefit, though. It's different than SNAP, where you can spend it on a variety of things. It's very prescribed. So if the mother is breastfeeding, she gets a certain allotment of certain types of food. If they're bottle feeding, they would also get a formula and those types of things. It doesn't cover everyone's food, so it's a supplemental program. That's part of the language.
Why don't you explain Why don't you tell them what WIC stands for?
Women, infants, and children, yep.
Because you two new people, you're gonna find
Yeah.
that there's all sorts of acronyms
Yes.
that Health and Human Services use, and
20 pages of them.
Yes, yep.
I didn't bring my handbook. So
There'll be a quiz. Yeah,
Thank you.
Commissioner DeLidens is preparing you for the quiz, so. No, thank you for that. It is a federally funded program through the USDA, so the Department of Agriculture, which is different than a lot of our other funding, comes usually through HHS or through the state. Right now, as mentioned in the summary, the majority of these programs are run by counties, either in a multi-county collaboration or single county. The two other counties that don't have it are moving forward with bringing theirs in-house. So if Wright continues to use community action, we'll be the only county that doesn't have WIC in Health and Human Services. So that's just something to be aware of. Much like our programming, WIC has been granted some waivers, which has been really good for families. I know that across the state, there has been higher utilization of WIC services because they've been allowed to do a lot of the education piece virtually. So they're doing a lot of telemedicine, like connecting with their clients to do some of the nutrition education component. Wouldn't surprise you that when we're talking about young families, they really like that and not having to go out into the office. So they've seen, I think across the state, and I would assume from the numbers that I've seen for our program that the state releases, that our community likes that as well. So I know there's a lot of effort from AMC and the local Public Health Association to have that waiver continue after COVID because it's made the program more accessible to families. In our case, that means that the enrollment has gone up, also probably because there are more people who are eligible because of the decline in the economy.
And this is, you have to, your income can only reach
Right.
a certain level.
Yeah, you can also be eligible, if you're not eligible by income, if you're eligible by being on Medicaid, you can also, it's cross-eligible, which is many programs that we offer here. So that's where I think counties have seen the alignment. So, so the grant amount, at least for the beginning, you get your grant amount based on the number of enrollments you have. So the higher the need and the more people you're serving, the higher your number goes up. And currently the state adjusts your grant amount every quarter. So if something happens like COVID, they've made adjustments as you've seen more people. So that's helped. And when we talked about this with the board members that are present, I think we were looking at more like $300,000 or $325,000 a year. Now it's close to $400,000 that they're anticipating for the first quarter of 2021 because their enrollment has gone up.
So likely with the waiver that potentially would continue, but without the waiver, potentially people would fall off.
Yes, potentially people would fall off. I mean, I think it all also is dependent on what the recovery is like in the community.
It's always a revolving number
Yes.
because you age out of it. I mean, because unless you're
Yes.
continuously having babies, I mean.
Right, so
if
if being
age
one of
four,
the youngest counties in the state, you know, we're probably fairly well placed if we, you know, with good recruitment efforts to have a pretty stable number.
I'm pretty certain that most of those people in Otsego that are living in $400,000 homes, they wouldn't qualify the income.
Yeah.
I mean, either that or I don't know how they're making their mortgage payment. I mean, just, it's,
Say mine too, all the new ones,
new ones.
300,000 and up.
But I guess the piece that I'm like, okay, the delineation, which is say, for example, the grant amount is $400,000. The delineation from administrative costs versus the amount of money that's actually put out onto the WIC cards for the purchase of the product.
This is operations, I believe, the
Yeah,
375.
that's managed. The benefit is not.
So it's
It's like your
straight
food
400,000 is administration versus.
So it's like food support. Our food support is run through the Department of Agriculture. They don't count the food support benefits that go out as coming through us.
Right.
It goes directly out.
And so then my next guess question is that you're gonna say that this is like a 2.5 to a 3.5 FTE to administer the process, to administer WIC,
Well-
based on what WCCA is doing.
And I just wanted to be clear too, and I'll let Sarah answer that. We were going to bring this information to a board, and Commissioner Vetch said maybe this is a better thing just to have a, more focused discussion here. So we didn't do like last year. We came with a lot of information and brought a lot of statistics. And this time we kind of took a step back and said, once we hear what direction you're thinking, then if you want more information or, we could certainly fill in some of the holes. We can make some guesses now, but we didn't do the same preparation that we did last year.
And there's a couple variables in that too, about if you think about whether we'd add FTE or if we'd be able to realign some of the FTE that we have. So from, and Jamie and I have talked about this, in fact, I was just letting Christine know this as well. DHS put forward, and again, different agency, but put forward a significant cut in their budget to our programming in public health. They are proposed to cut the child and teen checkup program by almost half. That's actually, some of that money that we give goes to Wright County Community Action to do outreach, and they use it to help, my understanding is to help their WIC budget, or just to help their budget in general, but they get of that, and it's going to be a very similar number, but it's about $352,000 that we get every year from DHS. That's going to be cut. Now, if I don't have staff working on that, I would put them on a WIC program. But we also would have to consider, if we're getting a 50% cut, do we give that $8,000 that we give to community action right now next year? Or do we, it's a big
Shore
cut
up our
for us.
reserves.
It would
Right.
be $350 on the child and teen checkup, which I will honestly say, in my household, we've gotten those things in the mail because of the conglomerate of kids that we take care of. I don't even understand it because I'm thinking, am I making, they have their own provider. So I'm thinking, why are you sending me this? Because they have their own provider, So what is that mailing? In the trash every time, and I'm
Well,
guessing.
we've asked DHS to allow us to be, nobody likes letters, right? But they tell us that's how we have to do
But
it.
there's no education in the letter,
Yeah.
because I'm understanding, okay, am I making an appointment to take my kid to the county for a well check, and why would I do that versus taking them to their primary care doctor? Either way, because if a kid's on, to get this letter, they're on MA, why would I go to this one versus this one? Because almost 90% of everybody that's, probably maybe not 90, but 70% will say, has a primary care doctor that they see. And it's probably closer to home than Buffalo. So the question is.
And I think if your kids are seeing a doctor, that's good. I think where the state is coming from are these kids that are not being seen and things are going left unresolved.
And it's really to promote them to get to we want them to have a medical home and we help them find a medical home. It's not necessarily to have the county to be their medical home, no.
And I guess, I mean, I can see why that program is just, it's inherently set up to probably fail, because either way, you're mailing, your greatest way of reaching out to them is via mail.
Yeah.
And these people are if they're not doing their primary care doctor, they're probably not reading their mail. I mean,
I would concur with that statement.
Yeah, we would like to be able to do outreach in different ways and have asked DHS the permission to do that, but
regardless, I can see that program going away,
Yeah.
because obviously they beat their head against the wall long enough to realize that we're not going anywhere with that. So
I think the state's going to keep the money and try to do more on their side with the money
Which
versus the
probably
so it might not resolve your issues of getting things in the mail.
no, but whatever. At least that.
So when we talk about FTE, it gets a little gray, because we can probably absorb some of that with the staff time that becomes available if we receive a significant cut from CTC.
And we weren't aware of that when either last year or even this year when we started talking about what's going to happen for the next 5 years. So that's been a development that's even just occurred, I would say. There's been discussions about it, but it's looking more and more like the child and teen checkup funding will not be available to us.
Is that because the legislators are cutting their budget, or is it because they're keeping their budget the same and it's a way for the Health and Human Services down there to make up for?
I mean, I thought it was that they're not cutting the budget, that they are going to redistribute where the money goes.
I just know that it demonstrates a cost saving to DHS, and so it's in the governor's, what they propose for DHS, because they're looking for cost savings everywhere.
Big factor of it.
Right, so, but it'll be at the cost savings at the state level will be at the expense of the county, so.
Be better putting more money into the clinics to reach out to people than they would be then to do it through the county.
Oh, yeah.
Yeah, I think, I mean, we can talk, I think sounds like you're very interested in this topic, and I would love to talk about it some more, because it will actually be my understanding of what they're proposing will probably get very complicated in our county, because it will happen differently whether you belong to an Alina clinic or a Centricare clinic versus Stellis. And so some of our more independent clinics will be impacted differently than our bigger systems. And the way that the client or the individual like yourself, Commissioner, will experience it could be different, which just makes things more confusing for the general public. Yeah. It's always a concern.
Well, Commissioner Potter used to say, this is government, there'll be no common sense here.
I mean, I see the point. I mean, it is a large threat from us from a standpoint. If we would lose $300,000 in funding, I mean, this is just one of many possible solutions to backfill some of that. And I mean, is there probably capacity in there based on our utilization and what we have been able to do with that teenage well checkup, even if it still existed, but on a smaller scale, there's probably a lot of capacity still there.
We have room in the county for improvement in that area. I would say it's one of the areas that we saw a significant hike, but I don't believe we're meeting the threshold in that particular area right now.
I think we spent it all this year.
We spend the money, but I don't know that for the threshold of obtaining the primary kids in foster care getting to their checkup within a year. We've made strides in, but we haven't won it yet.
And we would still be working on that particular metric at the county level. That's what some of the funds that they would still give us would be for those unattached families that don't have a primary health care provider.
And I would just say, like, in general, it's like, you know, whether or not we preserve staff or, you know, we don't preserve staff because funding goes away, I just wanted the board to be aware of some of these opportunities and things like that for WIC, and I especially think moving into the new building and some of the things that we could tap into, some of the alignment, as Sarah said, with medical assistants and our PSOP type of folks and our children's mental health outreach workers and some of the things that we have in place as such a young county. You know, I think last year our conversation around this was very emotionally charged, and I'm kind of still at a loss as to some of that. I just wanted to, you know, have a good conversation about what we stand to gain and what we stand to, and I wouldn't say lose because we don't have it now as a county. I think there's a reason we're the only county without it. I've heard Jay Weatherford from Community Action say many times that they're the only community action that operates in only one county. So I think there's maybe a shift, and you've heard us talk about it, to a more, I don't want to say regionalization, but partnerships and things like that, that just the economies of scale and things that can be achieved when we look bigger and broader and being able to share. So not only the leveraging our own staff, but potentially if we were to work out something with other counties, that we could work better together to bring some of these services, you know, to families. I just hope you take some time to take a look at all the bullet points. I think, you know, again, we see, and I think we recognize that a threat is our relationship with community action, you know, in the short term. I still think, and we said last year, I think there are still opportunities of working with community action in either this or other areas. They've kind of, and I have not spoken with Jay. This document is in the agenda today, so he certainly has access to it and can view it. They've, as you know, been working very strongly with the adult population and especially with the senior population. I think there's definitely areas that we could do more collaboration and even potentially sharing of things in, you know, in that area. So. I don't want to take anything away from them. I think they are opportunities. And I'm just saying that as your Health and Human Services Director. You know, if you decide not to go that route, we're going to be fine. You know, we will figure things out as we go forward. We do have a young community, and I would just really like to see them get all the resources that they can so they can be self-sufficient sooner versus later.
Mr. Chair.
Yes.
So how would you be able to do better outreach if it's all being done online?
So the outreach still happens in the community. It's that once the person's enrolled that the education is happening online. But we, you know, I think we are well put, as I put in the document, you know, we already do community outreach with a lot of our programming. We have the WOW band model that exists where we're going to different communities. We have very strong partnerships with our healthcare providers. So when you think about enrolling that way, in fact, because we've struggled over the years with our getting referrals and having a connection with WIC, which for other counties, Commissioner Delight, and you will know that's where they get most of their home visiting clients. We've spent a lot of time working with our healthcare partners that have birthing hospitals and take care of pregnant women. And so in that ways, we're probably really well poised because we've been working on those relationships. You know, it's a little bit different in the COVID world, I think, for all of us because everything is, you know, connecting with those folks virtually, and the only place most of those families are going is to their doctor's office. But again, it's just making sure that we get those connections.
Here's like the interesting point that I think the way it works now, because I'm somewhat mildly familiar with it, because most of the people now are finding out that they qualify for WIC either through their school or through their primary physician, because they go to the primary physician, your primary physician sees that they are MA, and they say, have you applied for WIC? Or the school does the same thing, you're free and reduced lunches, have you applied for WIC? Now, in a better sense of the world, at the county, we already know they qualify through our third floor, because if you apply to get MA, instantly you should be mailed a WIC application. I mean, if in the sense that
that would make sense, as somebody said, quoted Commissioner Potter a little bit ago. I don't think that happens because I don't think that MA Met system is looking at the ages of the kids to see if those ages correlate with the WIC program.
But it does know the ages, and it's very...
Yeah, well, I mean, we've never been asked to do this because we've never had WIC. So I think that's one thing that I think if we were going to move forward with that is how can we do that? Yeah, make it easy, right, for the client. It should be seamless for the client.
People within the system, I would think.
Well, isn't Wright County Community Action providing more leads to First Steps than any other group?
For us, I'd have to check. I do have their referral data, but I don't.
I thought
WIC in
when
general for all four of us is for all four counties. Just for those of you that don't know what Commissioner Delighten's referencing, he sits on our joint powers board with Wright, Sherburne, Benton, and Stearns for home visiting. And I do have their referral data.
I know when I looked at it, it seemed like they provided more referrals than anybody else did.
And that may be true.
And they should.
I mean, that would be good because all of our other counties, WIC, even internally, they still have to do a referral process. That's part of the USDA's rules. But, you know, I still think there could be more, I think is what we've been trying to work with, Jay. You know, we were working and having conversations about that before COVID hit and have not been successful in having those conversations since then.
So if somebody calls you, the Wright County, do you refer them then to Wright County Community Action?
Absolutely, yes. And if we have home visiting clients that aren't on WIC, and we know that they would qualify, right? We know they're on medical assistance or they would be eligible, we send them that way, yeah.
Because I can see, you know, somebody that's new to the area, which a lot of this is, they probably might go to their city first, and their city will say, no, we don't do nothing like this. Contact your county. Now, does the cities know that
We don't run the program.
Yeah, oh, yeah, yeah.
Yeah, I don't know if what other places they receive for, I mean, that would be a question
Yeah,
for
that
community
recruitment
action.
and finding families, that's all, that's all on community action at this point.
Okay.
Mr. Chair?
Yes.
One thing
Something
about
good to know.
bringing this in-house is that instead of sending them to yet another spot, they'd be here, they're potentially your clients already, and it would seem like it would increase efficiencies for them and for the program, but that's my take on it. And I think community action does a lot of wonderful things, but, maybe some programs make more sense to be in-house.
Mr. Chair?
Yes.
So yes, I was the one that contacted Community Action today to get a little background on the other side when I saw them up there in parentheses. So talked with Jay, and for whatever reason, he didn't know it was on the agenda, but that wouldn't have affected the feedback and what I had here today now from him. But what would be helpful for me is if, sounds like you did it last year, but you guess your best when you come to a board
We've
and
got
some
lots
of the
of,
numbers have changed.
information from,
But it would help to see what we're getting for the 375 from them versus the 375 if we did it in-house. It sounds like there's some building rental now, and there's like 3 satellite clinics around the county, Buffalo, Monticello, and Howard Lake. What would that look like in the future? How many full-time employees at the county would this money cover versus full-time employees at Wright County Community Action? So that'd be helpful for me anyway, maybe others to process. If you're gonna compare apples to apples, we should really see, how do you propose this 375, if that's the figure, is gonna be spent? And then we take a look, where are we getting the best bang for our buck? That's my thought after hearing you and talking to Jay.
and that was gonna be my final observation. What do you want from us, in order to go forward? Or if you're gonna say no, don't even bother. If you're gonna say go forward and get more information and come back with something,
Well, otherwise we're just kind of guessing here, but show us some numbers. Are we gonna lose these 3 satellite clinics in lieu of centrally locating everything? And
Oh, you can't?
No, you're not allowed to.
Okay.
We would have to operate some satellite clinics, that's a requirement.
Okay.
And that's why I mentioned that we already have, we haven't been to them because of COVID, but we have established WOW van sites. We go to Cokato, Delano, St. Michael, Monticello, Annandale now. So there's no reason why we couldn't discuss whether those sites were appropriate for WIC clinics. And I know that Jay has relationships with school districts to run some of those as part of the ECFE programs, I think.
There's a couple churches, I think he mentioned, that they're renting some space in, but,
No, that's not for WIC, that's for Head Start.
oh, okay. Okay, because
Although they may be doing their,
he's connected it somehow. it
but
sounds-
yeah, the Head Start, yeah, they're renting a number of churches and other locations, schools, they're working with schools. But, yeah, they may rent a church or two for their WIC outreach. But I believe they have one a month in each area, if I remember correctly, which I think is what the requirements are.
It's my understanding from most counties that I've talked to that run the program internally is that, it's still, I'm sure they all staff it a little bit differently. I know that some of them use their public health nurses, which is allowable by the grant. Some of them have dietitians. And so I can come up with a staffing metric, that's no problem. But I think what ultimately realizes that it's like, they're not, most counties, I think Stearns would be an exception that I know of, are not putting in county dollars, right? So you still have to meet the expectations that are set forth in the grant, and most of them are just what comes in from the grant funds goes out in staff time, and it's zero impact on the county, so.
Mr. Chair.
Yes.
So if Wright County took this over, would there be enough time for you to take it over from the Wright County Community Action, or, because they have it in place already, and now you would have to take it over, and
Well, yeah.
But it wouldn't be until 2022.
Yeah, I understand that, but it takes a certain
Well, and we do
amount
start
of-
programs often from DHS that we all of a sudden have a new way to run child protection, and we're used to hitting things, you know,
Like that?
very,
Okay.
very quickly. Our public health staff, I think, would be very, you know, able to, would have the knowledge base, you know, the skill level. It's really right now seeing what, you know, what the direction of the board is looking forward, because it's 5 years, you know. Honestly, in 5 years, I probably won't be back here asking for it anymore. You know, I'll probably be retired by then, who knows? So I'm just kind of, and it's a long period of time, so I just want to be very thoughtful about what this looks like for our families going forward. I'm really, I don't want to sound all dramatic, I'm less concerned about how we take it on, because I know we can do it. You know, my bottom line is what's best out there in the community, you know, to make sure that families are getting the resources they need. And I want to be a good partner with community action, but I think this is, any way you look at it, it's going to be a difficult conversations one way or the other. And we're not, and I think maybe Commissioner Ketchmark said something, you know, like if we do the right of first refusal, then we're really out. It's not like it comes through us, and so we're not watching them to see what they do. You know, it's like they're then the person that's responding to MDH. We're kind of, you know, it's not like that we're not subletting it to them. You know, it's their baby.
Yeah, we're not I would agree. We're not the sub-grantees, so, I mean, if you wanted to ask questions about performance, that's really should be directed to them.
Because we don't have eyes on them. We know we would like to see more referrals, you know, and historically that's been the case. And then a weakness, obviously, is that we haven't run the program. I feel confident we could run the program. You know, you could question me a year afterwards, but I'm pretty sure it'd be you know, with Sarah at the head, that it would be a well-run program. Sarah is currently looking at, even outside of this, reorganizing in public health a little bit post-pandemic to see how some of the programs could fit in better and how we just internally could be in better alignment. I do see it as an opportunity. I don't want to take anything away from anybody else or say anything that, you know.
You know what I'd be interested to know is what percentage of people that are, I mean, on SNAP are on WIC. I mean,
Oh, like eligible versus enrolled?
yeah. I mean, because realistically, I mean, it is, the only difference is that you have young kids. If you're, the reason you would be, because
WIC.
you're WIC. Because otherwise, they're probably on SNAP. Everybody that's on, not necessarily because there's a higher income hold on WIC than there is on SNAP, but not by much, but there is. If I remember correctly, I think you can make a little bit more money and still be on WIC versus being on SNAP. And it's just,
And I mean, there's always going to be people who don't enroll because of stigma.
I mean, we could see like what percentage of the population is on SNAP versus what percentage of the population is on WIC that would be eligible. You know, we could do something along those lines. We can ask for ad hoc reports, but when it gets to the Department of Ag, I don't know, you know, if we have any, how much say we have in some of
my
that.
thing is they track so much of this, like they know what the utilization is on what they're buying
They do.
off that SNAP, those SNAP sheets. Because there's a multiple factor problem here, because if you're able to get SNAP where you can go in and buy anything you want in the grocery store and you have your WIC and you have both, is the WIC getting utilized? Probably not. Maybe not. Then there's the complexity of the grocery stores, because depending on where you go, Walmart, good luck finding out what's qualifiable and what's not. Because even if you think it says so much cheese, but it's...
You get to the cash register and it says something
It
different.
says something different, exactly. So a lot of people just get to the point where they just say, heck with it. I'm just curious of the people that are on the WIC program that actually are able to, that are actually utilizing it. Are they just on it for the easy item like milk? Because they know that milk is, no matter what milk you buy, it's going to qualify. Whereas all the other items on there, it's kind of like a guessing game in the quantity, size, and whether it meets it, does it meet it, is it a whole grain item, is it not a whole grain item? Because Target does a fairly decent job on it, on labeling their things, but it's a very narrowed scope of like, here is the only whole grain item that you can buy that is WIC marked. Everything else you couldn't buy.
That's interesting, because I know like in, and I haven't looked at it lately, but like in the
No,
food
so it's
support
on the
program,
store.
we know how many benefits go out the door. I don't know if we know how much is utilized.
So They do know. I don't know what it is for
But
Wright
I mean,
County,
that's a
but yeah.
big piece to knowing about it, because that tells us whether we're educating the people about it or we're not educating them. And there's educating them about the benefits of eating these foods, but then there's educating them on how to buy these foods in the store, because there is a huge educational factor, and most of these people are in this area aren't gonna, if it's hard, they're not gonna do it.
Sure.
You
Seems like
know,
it's really obvious, and was that Cub? I can't remember, but I see it.
Cub and Target do the best with it.
Okay, 'cause I've
Walmart
seen it,
is absolutely horrific. They epically fail. So Coburn's is also definitely down a little bit too. They don't label well either.
Okay.
So, but it's, you know, but then we don't allow, like, your where a lot of people buy Simplisms are like a Quick Trip. Milk, they're the only people buy that are MA that buy milk that is super easy because in and out, they have young kids. Being able to utilize them and being able to go into a place where they don't have to drag kids to the back of the store at Walmart, where they could use that same piece at a Quick Trip where they don't have to haul all their kids across a huge store. I mean, we want to make it easy and convenient and I mean, but those are things that happen at the state level, not here.
That's where extension comes in.
Do we have
And
diet,
extensions
I
at the
love
new building,
extension.
right?
I love extensions.
do we have dietitians on staff?
No, we don't. So there are a couple choices with that. We would make a new job class and have to go through that, or you are allowed to use the public health nurse in that coordinator role.
As a dietitian? But would you prefer to have a dietitian?
I think it's a conversation about who's the right person for that job. So, I mean, it sounds like from the rule book that you need to discuss with MDH if you're going to use a PHN, but you're not excluded from it, and other counties do use public health nurses.
Mr. Chair, I think at least we should get some more information about this, and, I mean, whatever we can do to be the most efficient and most effective with serving people, I think is what we should do. So we're kind of set up in so many ways already with SNAP, and I think it'd behoove us to move forward for more info. But
I think the other thing to be aware of, board, is that it's still an option for us to partner with one or more counties to provide the resource as well. So where they would still, obviously, I mean, if we were going to have a spot in our new building, or we would have to find satellite clinics that are, I mean, that's a requirement. But we can partner with another county, either, you know, the ones that are bringing it on in-house are going through the same process at the same time. Is that, you know, more efficient? You can have pay for one coordinator over multiple sites versus each county having a coordinator. That's a way to gain some efficiency. So, I mean, there are other opportunities that I can kind of try to surmise that in a follow-up report, but that there are some other ways to gain some efficiencies that would potentially get those grant dollars to go a little bit farther, and possibly make it easier for clients, right? So you have to see you have to go where you're enrolled. So, but if you're a multi-county, then if you went into, you know, if it's easier for you to go, I don't know, to go to Elk River instead of going to Buffalo for a site or something like that, for instance, then that would be something that would, if we were in partnership. Right, if we were in partnership with another county.
So I guess if we were going to entertain the idea of bringing things forward, I guess Commissioner Ketchmark wants kind of more of a cost-benefit analysis of us versus them. And then I guess there's the discussion of, do we look at economy of scale and partnering? I mean,
There's quite a few choices.
There is.
This is why I mean firmly in in your realm. I can bring you the ideas, but.
And then obviously then there's the discussion of collateral damage. If we do pull out that funding, what does that do to Wright County Community Action? And is the collateral, is the benefit to us worth the collateral damage to Wright County community action in terms of their operations? And so,
Yeah, we have to
And
look
I
at
was
it.
considered too, when I had a brief conversation with Commissioner Vetch a number of weeks ago, the viability, do we know that? I don't want to be, I feel confident we can take it on with this, lead time, the 2022. But should something happen to community action and all of a sudden it's us, it's like tag, you're it, and it has to happen in 3 months or something like that, and maybe not next year, maybe in 2 years or something like that, then we're in a less enviable position because then we're reacting to things out of our control. So I'd rather just be strategic about it and make a decision one way or the other. And I just also wanted to mention, because Sarah brought it up, but if MDH, or, if we lose our child and teen funding, I always get it mixed up, child and teen checkup funding. Again, then we'd have to look at that funding that currently is helping community action with some of their programming, that I'm not sure that we'd be able to do that in a budget that would be cut in half, which would potentially lend itself to some financial discomfort on their side potentially. Isn't that a nice way to say it?
Yeah, and those are factors that, we need to look at and weigh, and what, like we said, what's the cost analysis.
So we kind of glossed over it in this. I don't want to set us up for, an expectation that we're going to have every number coming back, because we don't have their numbers. We can come up with some prognosis where we're at. We can find probably numbers from MDH on referrals, and we can ask community action for additional information, or they can present their information.
We got 6 weeks before the application deadline or so, is that right? April 2nd?
Yes.
Is there a community action meeting between?
We'd have to
now
express interest before then, is all.
and
But
then
Yeah,
to
we
meet
got-
or-
fine.
Or beforehand, Jay, I'm sure he'd be anxious to send his information, if he's interested in keeping it, to the board members that are on community action, potentially.
Oh, yeah, it'll be discussed. It's, our next meeting is the second Tuesday,
Okay.
I guess,
which would be the same day we have Health and Human Services.
I would say, we'd look at doing like a committee of the whole, somewhere like March 17th, 18th, or 19th, kind of somewhere at that point after you guys had your community action meeting, circle back.
When do you have to have the letter of intent, the 16th?
Oh, I wrote in my,
The March 16th, although I would assume that we could withdraw if it
right,
was.
we could put it in like as a
the
possibility
timing.
and then not act on it if that's the decision of the board later. And yeah, and if you can find out, if they have referral numbers and things like that, that would be great to get information from.
Or we could meet like the 11th or 12th, that, you guys have your next, on the 9th?
Second?
Tuesday.
Second Tuesday,
Yeah,
yeah.
so we could on Tuesday schedule a committee of the whole on the 11th or 12th to present both sides, have community action come out here, and we'll just kind of hash it out, and then we can come out after that Thursday or Friday with a recommendation one way or the other, and then they could submit their letter in
Yeah, potentially after the EDA meeting, maybe on the 11th.
on the 11th.
I'm just throwing it out, not to
Yeah.
set it today, but
No, yeah, we can just work, we have
Friday,
EDA. Yeah, we can look at those Friday morning,
or Friday morning.
or Friday morning, yeah, either one's good with me, so.
Which dates are you talking about?
The, March 11th or 12th, that Thursday or Friday.
I've got,
You got EDA on the 11th.
Yeah, we'd be doing it on Thursday morning or Friday morning.
I've got 3 meetings on the 11th and 2 on the 12th, but we could work around them.
Work around it, so. Well, I guess we'll circle back on that at our meeting on maybe Tuesday to solidify it, so.
Yep.
Let's just kind of target those 2 dates, and that gives Jamie and HHS some idea of when they need to put something together by.
And I saw on the list here on the bottom, external factors, something about the wall van model. Could you explain how you would work that way?
So that was what I mentioned earlier. So we currently have a van and we also have a trailer, but
What is WOW stand for?
Wellness on Wheels. We've had it for many years. So right now,
It's a
nurses.
vanguard. Our county's a vanguard in this area.
Hey, it saved us a lot of CARES Act funds because many other counties bought vehicles to go do testing and shots, and we don't need to do that. So prior to COVID, obviously when COVID struck, a lot of outreach in the community across the board was put on hold, but we were providing services in multiple, usually either libraries or community centers. And again, you have to have, as was mentioned, you have to have multiple clinic locations that are accessible to families. So we already have those relationships, and we already have a vehicle that we use to get people there, and it's something that my staff are very familiar with running, so.
And the WIC is done normally in the evenings.
And we run those clinics into the evenings as well, the ones that are out in the community.
I see them in the paper.
Is there any other information you want us to bring back? I brought, some logistics or some dollars, staff utilization, numbers.
Impact on community action.
I mean,
That would be,
I'm not sure I can speak to how that would,
Well, Jay.
yeah.
yeah, sure you
Right,
would.
yeah.
Yeah, I
we
mean,
will hear.
that's
I don't want to make presumptions other than I know what the dollar amount would
Right.
be significant.
Yeah, once we solidify the exact date, then we'll let Jay know.
All right. Well, is there any other things to discuss on it? I think we got some direction on it. You can, anybody else, members, you feel free to reach out to Jamie if there's other things you think of after the fact that you want them to have on that meeting on the 11th or 12th. And we'll make a decision one way or the other then.
Sounds good,
All right.
appreciate it.
Now, quick question, completely off topic. What do we do for seniors other than waivers? Do we provide or help with, well, I know we do SNAP for them, but housing, do we help? Do we have anything available for seniors in housing and stuff?
So I'm trying to think,
Well,
like
you
our
do if you have
GRH,
issue of moving out of
GRH
income.
housing is with seniors,
Well,
to
if they have
some
no
extent.
assets and they're ailing and they have to go into long-term
Well, all the
care.
long-term care, that's our
Yeah.
fastest growing
Yeah.
population is all of our long-term
Yeah.
care.
No, I'm just
So
talking
we
about
don't
if
do the
they're-
housing, but we pay go through MA to pay the nursing homes,
Right.
kinds of
But
things.
this is to keep people in on
We
a,
don't have like chore service, that Community Action has. They're currently, I think, calling seniors like shut-ins and things like that. We don't do that. We used to have a PCA service that we did years ago under Carol Schaefer's and
Yeah, we haven't had that for many,
haven't had
many
that for
years.
a very long time. We do, of course, like the 60-plus clinics. We do the, that the same as the foot clinics?
Is, yeah, 60 plus and healthy is, so we do blood pressure screenings, and then we offer a foot clinic or a toenail clinic for seniors, either at the community centers or at their senior living facilities.
So I would say across our programs, we don't always call it a senior service, but obviously within many of our programs, we have people that are seniors.
yeah, but we have no housing assistance other than if they're in a
Right.
nursing home.
Right, so this is when, I'm sure the board remembers the discussion about doing what's statutorily necessary to meet, what the statutes say, and most of the things I just said would not be part of that.
I should, because the only ways I know around is, because where my wife works at Cross Services, they refer people to a homeless housing service that they are able to put people, either get them into permanent housing or temporary housing, and their effectiveness is pretty high on getting it in there, as long as these people are willing to work or have social security income. If they have some sort of income, if they're unwilling to
They'll
work.
work with you.
Yeah, if they're unwilling to work at all or have no income at all, then they can't help them, but if they have a social security income, then they're able to work with them and getting them into housing, so.
And again, GRH, I think a good percentage of that population is older, but not nursing home
Well, that's
population.
what I was just gonna ask, how about seniors that probably couldn't work?
Well, that's where a lot of them, they work with them is because they're getting some sort of a social security
Yeah,
income,
okay.
and then they're able to use that social security income to put, depending on the amount of that, to put them in, I don't know how they do it. Obviously, it must be a lot of heavily funded donors.
We also have, and I'm not going to probably say it right, in our collections area, we do have accounts for people that can't manage their own money, and we have rep payee accounts. there. I think we've tried to contract some of those out, but I think we still have a number of rep payee accounts for people that are potentially in their own home but can't do their own financials.
Well, and I think that'd be important because a lot of the older people don't, well, they never had children or something in the case where a lot of times the kids would take over.
Right, or there's burnt bridges or other factors at play.
Okay.
Thank you.
Other discussions? Not, it's been fun.
I don't know, did you want to talk about this letter you left up here?
Yep, I just have the director's comments. I think I should say director's comments, but maybe it doesn't. Oh, it does say that. So just very quickly, I thought I'd take advantage of having the second board meeting. In front of you, you see a letter of support on food security, and, you know, we're just talking about some of this. So just to let you know that it was, that I signed that and sent that off to them, and it's, well, you can read it, I guess, but basically it's to support the prevention of wasted food and the food rescue grant. So we support Wright County Community Action's proposal to go for this grant. It values its partnership with Wright County Community Action and recognizes that the initiative aligns with our mutual mission for a healthy and secure environment. So that's just an FYI. I also wanted to take an opportunity, and I think you're all aware of it, but just how thankful and appreciative Health and Human Services is to the Highway Department for what they have done with our drive-through clinics and everything.
That's really
I mean, it's just amazing. I was on a director's meeting call on Friday, and Amanda, the director from Sherburne, says, yep, she's going to come over. They're going to view it to see how it all works because she's hearing about it over there. So Virgil and his gang have just been fantastic to work with, and we couldn't be more appreciative. We'll see how this whole pandemic and vaccination plays out here, but right now it's just really nice to have those partners as well. This week we're using the Dome in St. Michael as well. So again, it's just great to have these community partners where, you know, a lot of times we think, oh, we're big HHS and we've got all these things going on, but we can't do it without, you know, the help from everybody. So that part's just been very,
We are using the Dome, yeah.
yeah.
You won't be able to drive through that one.
No, we're not.
They need to park in the
Just curious.
I was wondering the same thing, Commissioner. I thought, oh, do we get to drive through?
Yeah,
Yeah.
spent a lot of money on that.
I appreciate both the highway department and St. Michael have been incredibly flexible as we have dealt with numerous false starts with getting our vaccine. It's been, I'm sure you all saw the letter to the editor from our representatives. It's been a particularly trying month. So
I think it's really hard when we're ready, willing, and able.
Yes.
And then, well, then we're not able, you know, so I think it's been
the only
frustrating
thing we're
for staff.
waiting on is the actual vaccine. I mean, we had,
Is
yeah.
it a little bit more easier or something to get the vaccine? Because Friday I got notified by North Memorial that I'd won the vaccine lottery.
Oh.
And then Saturday I got a call from Stella's Health and I could get my vaccine there shot. So I thought,
I think there,
I was really surprised, you know?
well, I think there's a couple things. One is that we are, I think, supposed to be getting some more doses from the federal government this couple next weeks. So that's one thing. I think the other thing is that we haven't opened it to any other groups. So there's still many
They're
counties.
finding you.
No, many counties are done with their seniors, or I'm sorry, not their seniors, with their
Teachers.
schools.
Oh,
And so that is being redistributed. We have, unfortunately, I feel like barely touched them. And
I
it's
won't-
not for fault of trying very hard, but
I
you
won't
can't
tell
give
you
shots
what
if you
my
don't have
husband
vaccine.
said. He said it was political because Wright County is known as
I
a
hope-
certain
If that's,
county.
I really, I mean, that would
We
make
don't
me
agree
terribly
with the
sad.
I would be, yeah, that would not be good. I also wanted to let the board know, just because I had to ask you when I applied for it, but I'm resigning from the Workforce Development Board. I've been on it for a number of years. I just don't feel like, given the current situation and the demands on my time, it's something I can really do adequately. So I have let Barb Chafee over there know that I'd be resigning, and my term goes through June 30th.
Okay.
And then, just in case, I think all members, or maybe
30th
the,
of March?
what's that? June.
June, he's.
Yeah, so I'm still on it through June. I'll look for a replacement amongst the other, I think, 11 county directors. So I serve on the Community and Government Committee on that board. It's been a really good experience, and I went to Washington DC a number of years ago with them. I mean, it's been a good experience. I think it's just time to let somebody else have the opportunity. You maybe received a letter, I think it was dated the end of January, the state audit findings. I'm just wondering if you had any questions. It's the 2019. So I just spoke with Christine Partlow just to make sure everything's on track, and we do have a corrective action plan. I think they're just asking for more details. So it's known to us, and we're doing it. I think we actually did everything we needed to do. So we'll be.
Yeah, you'll show us, you provide us with the action plan then?
We did, I think, back in June or July,
Provided it with that to us already?
Yes, I believe we brought it in to you. That's what Christine told me, that we presented it back. And it would have been with the whole county one that Bob Hevola would have turned in.
Yeah.
Ours would have been part of theirs.
Because I remember we talked about some of the different aspects of it and trying to meet the.
I just didn't want you to think that there was some kind of gap or something like that. The plan is out there. I don't know if they just want more information on the time frame or something like that. So we will find out. In the meantime, we've had our next audit, so we should be finding those results pretty soon, I suppose. That's all I have.
That's all you have? Anybody else?
What was this, 2019?
This is 2019, yeah, because this is with the corrective action pieces from 2019. So then we'll be finding out what new ones there may be for 2020. And
Yep.
some of them, it doesn't matter because, I mean, which is good that they look.
You fix
that
one,
fine
plug one
tune the
hole, and you
Right.
find another hole maybe,
Yeah,
I don't know.
You're just not ever going to
Yeah.
be perfect. You just don't want to have one of these that's like mega, like this thick.
I just thought that might have caught your eye, so I just wanted to bring that up.
Yeah, I just came, well, I
Okay.
just seen it today.
Yeah, it was dated January 27th, but I think it just came across my desk too, so.
I always say you never get audited for nothing, so they're always going to find something because
And this is, I think it was in MA.
they're never going to. I mean, I don't think anybody gets one back going, "You guys are perfect."
Well, and I think what our plan was additional training and something else. So it was a fairly soft plan, but I think what they were getting us on wasn't a system or wasn't attention. It really was to make sure that you take, these 17 steps in order to achieve some integrity level or something like that. So it really is a training issue.
Okay,
Well, very good.
yeah.
Thank you, everyone. I guess we will adjourn the HHS meeting at 2:28.
Thank you.